Healthcare costs in retirement. A 65-year-old retiring in 2026 can expect to spend an average of $172,500 in healthcare and medical expenses throughout retirement. But most Americans estimate they'll need only $2,700 per year. In reality, at age 65, the annual spend is close to $6,500 per person, $13,000 for a married couple. That's a massive gap between expectation and reality. Here's what you actually need to know about healthcare costs in retirement. But before that, subscribe to our channel so you don't miss future money-saving tips. In this video, you'll learn the real numbers behind retirement healthcare, why people underestimate by over 300%, the difference between Medicare plans that can cost you hundreds of thousands, and the one tax-advantaged account most people ignore that could save you $50,000 or more. 80% of respondents say they're worried about how they'll pay for healthcare costs in retirement. However, just 56% have factored the cost into their wealth plans. 1 in 5 Americans say they have never considered healthcare costs during retirement. This is denial mixed with ignorance. Healthcare expenses rise faster than other costs. General inflation runs around 3%. Healthcare inflation runs 5%. That compounds dramatically over 20 to 30 years. By age 65, healthcare expenditures will likely account for 15% of an individual's overall spending. That makes it the second biggest expense in retirement after housing. But unlike housing, healthcare costs accelerate as you age. Healthcare makes up 12% of spending for younger retirees, age 65 to 74, versus 16% for those 75 plus. Let's break down what you're actually paying for. Medicare premiums with prescription drug coverage account for between 73 and 81% of annual healthcare costs for the majority of retirees. These are predictable, fixed expenses you can budget for. The remaining 27%? Out-of-pocket costs. Doctor visits. Prescriptions. Medical equipment. These vary wildly month to month and person to person. In any given year, the median total healthcare cost for a retiree is $3,600. That's manageable. But here's the trap. Out-of-pocket expenses are highly variable and are the primary source of uncertainty in healthcare expenses. Only 10.9% of retirees experienced an increase in medical costs between $2,000 and $5,000 over a 2-year period. Just 2% experienced an increase of $25,000 or more over 24 months. Most years are fine. But one bad year, one hospitalization, one major surgery, and you're hit with tens of thousands in unexpected costs. Now let's talk Medicare. The two most common healthcare coverage options chosen by Medicare-eligible retirees are Medicare Advantage, Part D, called MAPD, and Original Medicare with Medigap plus Part D. The difference in lifetime costs is staggering. A healthy 65-year-old male retiring in 2024 with a Medicare Advantage plan is projected to spend $128,000 on healthcare in his remaining lifetime. A female with the same coverage is projected to spend $147,000. Women live longer on average, so costs add up. But switch to Original Medicare with Medigap. These projections increase to $281,000 for a male and $320,000 for a female, or a combined total of $601,000 for a 65-year-old couple. That's $474,000 more than Medicare Advantage for a couple. Why? Medigap has higher premiums but lower out-of-pocket costs. Medicare Advantage has lower premiums but higher out-of-pocket expenses when you actually use healthcare. Which one is right? It depends. A healthier retiree who values lower premiums over freedom to choose any healthcare provider may prefer Medicare Advantage. A retiree with higher expected healthcare utilization, either currently or expected in the future, may prefer Medigap. If you're healthy and don't visit doctors often, Medicare Advantage saves money. If you have chronic conditions or expect surgeries, Medigap protects you from catastrophic costs. Timing matters too. If you retire 5 years earlier at age 60, you can expect to pay 56% more for healthcare expenses than if you wait until age 65 and enroll in Original Medicare plus Medigap. That's 89% more than if you wait and enroll in a Medicare Advantage plan. Retiring early sounds great, but those 5 years before Medicare eligibility at 65 are brutally expensive. Most people cannot apply for Medicare until age 65. Private insurance between 60 and 65 can cost $1,000 to $2,000 per month. That's $60,000 to $120,000 before you even qualify for Medicare. Conversely, if you retire 5 years after turning 65, at age 70, you can expect to pay 30% less for healthcare expenses than if you retired at age 65 and enrolled in a Medicare Advantage plan. Work longer, earn more, keep employer insurance, delay healthcare costs. The math is brutal but clear. Now here's the solution most people ignore. Health savings accounts, called HSAs. HSAs are particularly prized for their triple tax advantages. Contributions are tax-deductible, earnings are tax-free, and withdrawals are tax-free when used for qualified medical expenses. No other account offers this. For tax year 2025, you can contribute up to $4,300 to an HSA individually, up to $8,550 for families. In 2026, that goes up to $4,400 for individuals and $8,750 for families. If you are age 55 or older, you can save an additional $1,000 per year in catch-up contributions. Only 23% of Americans say they are contributing to an HSA as one way to prepare for healthcare costs in retirement, and just 3 in 10 are investing their HSA assets. This is a massive missed opportunity. According to the Employee Benefit Research Institute, roughly 88% of HSA holders kept their accounts entirely in cash in 2021. Cash earns nothing. Invest it in mutual funds. Let it grow tax-free for 20 years, and you could have $100,000 or more for retirement health care. You can even use HSA money for non-medical expenses after age 65 without any penalties. You pay ordinary income tax, just like a traditional IRA or 401k. But if you're under age 65, you pay a 20% penalty on non-medical withdrawals plus ordinary income tax. Once you enroll in Medicare, you can no longer contribute to an HSA. However, you can use HSA funds to pay for many Medicare expenses, including premiums for Part B, Part D, and Medicare Advantage plans, though you cannot use an HSA to pay for Medigap premiums. You can also use HSAs to pay for in-home nursing care, nursing home fees, and long-term care expenses, including premiums for long-term care insurance. Here's the strategy. Pay for current medical expenses out of pocket if you can afford it. Keep receipts. Let your HSA grow invested. Years later, reimburse yourself tax-free using those old receipts. There's no time limit. You can hold receipts for many years and cash them out tax-free in retirement. That's free money growing tax-free for decades. Let's compare 2 scenarios. Scenario 1. No HSA. You pay $172,500 in healthcare costs from your 401k or savings. You pay income tax on every withdrawal. At a 22% tax rate, you need to withdraw $221,000 to net $172,500 after taxes. Scenario 2. Max out HSA contributions for 20 years. Invest the money. It grows to $150,000 tax-free. You withdraw it tax-free for health care. You save $48,500 just by using the HSA instead of a 401k. Same healthcare costs, massive tax savings. Despite these so-called big scary numbers, nobody pays for healthcare all at once. It makes more sense to view healthcare costs as an ongoing regular budget item instead of a lump sum needed at the start of retirement. You don't prepay 30 years of groceries. Don't think of healthcare as one giant bill. Break it into monthly premiums and annual out-of-pocket expenses. Budget for it like any other expense. One final note. This video is not financial advice. Always do your own research and consult with a financial professional for your specific situation. Here's what to do right now. Step 1. Calculate your expected retirement healthcare costs using the numbers in the description. Step 2. Choose between Medicare Advantage or Medigap based on your health and budget. Step 3. Open an HSA if you're eligible and max out contributions. Invest it. Don't leave it in cash. Step 4. Save all medical receipts for future tax-free reimbursements. Subscribe so you don't miss it. And if this just saved you tens of thousands in taxes and healthcare costs, hit the like button.